Antimicrobial resistance is a rising global health concern, threatening the effectiveness of antibiotics in treating infections. Among the most concerning resistant bacteria are Carbapenem-resistant Enterobacterales, which pose significant challenges in medical treatment due to their high resistance to last-line antibiotics. While CRE is commonly found in hospital settings, recent studies indicate its increasing prevalence in community environments, raising concerns about silent bacterial transmission. This study investigates the fecal colonization rate of CRE among volunteers in Raroeng Subdistrict, Wang Khiao District, Nakhonratchasima Province, Thailand, providing insights into its potential spread within the community. The objective of this study is to determine the prevalence of fecal colonization by CRE in a community setting, an area that has not been widely explored. By assessing the colonization rate among healthy volunteers, this research aims to identify the presence of CRE in non-hospitalized individuals and analyze risk factors contributing to bacterial colonization. By assessing the colonization rate among healthy volunteers, this research aims to identify the presence of CRE in non-hospitalized individuals and analyze risk factors contributing to bacterial colonization. The study ultimately seeks to support national and global efforts in controlling antimicrobial resistance by offering data-driven recommendations to mitigate CRE transmission in community environments. A cross-sectional study was conducted, and volunteers provided fecal samples for laboratory analysis. The study followed a structured approach, beginning with sample collection under strict safety protocols. The samples were processed using selective culture media to isolate CRE, followed by antimicrobial susceptibility testing to determine resistance patterns. Molecular techniques were also employed to identify specific Carbapenem-ACE genes responsible for bacterial resistance. This approach ensured a comprehensive assessment of CRE colonization rates, allowing researchers to evaluate its presence in the community and identify key factors that may contribute to its spread. The results revealed a notable prevalence of fecal CRE colonization among community volunteers, confirming that antimicrobial-resistant bacteria are not confined to hospital settings. The genotypic analysis identified key Carbapenem-ACE genes associated with resistance, highlighting potential risks for transmission within the population. Several factors were associated with CRE colonization, including recent antibiotic use, exposure to livestock, and proximity to individuals with prior hospital stays. These findings suggest that CRE may be silently spreading through various environmental and lifestyle factors, reinforcing the importance of monitoring antimicrobial resistance beyond clinical settings. The presence of CRE in a non-hospitalized population emphasizes the urgent need for enhanced infection prevention strategies, particularly in rural areas where healthcare access and sanitation practices may differ from urban centers. The detection of CRE in a community setting calls for proactive public health interventions. Raising awareness about antimicrobial resistance is crucial to minimizing bacterial transmission, particularly through education on responsible antibiotic use. Overuse and misuse of antibiotics contribute significantly to the development of resistant bacteria, making it essential to promote adherence to prescribed antibiotic regimens. Strengthening sanitation practices, including proper hand hygiene and waste management, can help reduce environmental contamination. Additionally, implementing community-based surveillance programs can provide ongoing data to track resistance trends and improve early detection efforts. By integrating these measures, public health authorities and healthcare providers can work together to limit the spread of CRE and other multi-drug resistant organisms, protecting both individual and public health. The presence of resistant bacteria in healthy individuals suggests the need for continued research into how CRE spreads in non-clinical environments. Future studies should focus on longitudinal surveillance to track colonization trends over time, evaluate the effectiveness of public health interventions, and explore additional environmental factors contributing to antimicrobial resistance.